for lighting in a healing environment, it's so important to have these fixtures look soft, look residential, look inviting, and really affect the healing process, because I mean, there are studies all over the place saying that the more comfortable a patient is, the more control they have of their own environment, the more familiar the environment is to maybe that home-like feel, the faster they heal. It can't just look nice, you know, it has to be functional, and it has to help that healing environment by being safe. So cleanable surfaces and having, you know, no dust shelves, providing enough light, but also having a multi-light level where you can control different parts of it, where you can dim it down if you want, having that all integrated into the bed even, so the patient can have that individual control, because when you have that individual control, that affects your healing process. Your lighting should be just as important as your finishes, as the furniture, the equipment that's going in there, and it should all work together. So what is Visa Lighting? We are a decorative lighting fixture manufacturer, but what I like to describe it as decorative functional lighting. So yes, we have glowing sconces on the wall, but we also have photometry files for everything. We know how to use it. They're good quality, durable products. The Serenity fixture line, it's a decorative patient room fixture. So it's a perimeter all LED fixture that has a functional light around the perimeter of it, but you're using the center panel of it to kind of create that decorative feel. They're all multifunction lights. The exam light that goes over the bed, so you have that in a 2x2, 2x4, or 1x4 tandem version. As far as the functional qualities of it, you have an exam light, a ambient, your general light source, and a reading light. You also have as an option an amber LED night light and a color changing light. So the idea of having an amber night light specifically for patient care is that it has those warmer wavelengths, where on the opposite side of the spectrum is the white bright blue light, and the blue light suppresses melatonin. When the nurses are coming in the middle of the night and, you know, checking on you, they might even turn on the exam light in some situations, and we're trying to get away from that. When you have that situation with a nurse coming in, I mean, the warm wavelengths of amber LED is really what you're looking for. So color changing is meant to be a visual distraction. When a patient's in the room for 24 hours, days on end, weeks, months on end, you need a visual distraction. It might be used in pediatric areas more, but if you're an adult, you still need something to take your mind off of why you're in a hospital setting. And that's what it does for you. Customizations for matching a specific environment with Serenity is the center panel. We have 4 different decorative panel options that are out right now. Those are printed on a vinyl material and adhered to the lens. So the idea is, as trends change, we can change those panels as well. So you have a few options, and we're meeting the minimum requirement for IS standards for your light levels with our base exam level. But what's nice about Serenity is that you can then bump up the exam level. So you actually have 3 exam levels built in that fixture. It's all coming from an LED source, so you're saving energy, you're creating this multi-level functional exam light, and you still get that decorative feeling above you. As far as sustainability goes, we're offering a few alternative metal finishes that, instead of using plating processes to get those looks, we're doing painted finishes and surfaces. We love to collaborate with designers to get feedback. We'll start adding on to the lines. So if we've heard a certain, you know, suggestion enough times, well, we actually do listen. I was a designer. I specified Visa. The quality is still there, and I can attest to it.